at night. Here we go. 3 things. Because 1 in 3 women, just so that you know that you're in really good company, 1 in 3 women actually have problems with their bladder and actually have bladder leakage. So about 33% of women are having these troubles. So please don't think you're alone. And it's really not, it's not an acceptable statistic. So I'm so happy that you're here so that you're not going to be a statistic anymore. Number 1, drink choices. This is one of the hardest things to even talk about when I speak with my patients, when I speak with clients or people that are in my courses. This is one of the hardest things to approach because we like to drink what we like to drink. What are some drinks that might make your bladder a little more irritable or make you have to go more often? Or maybe you've experienced yourself. Alcohol, yep. Caffeinated drinks. Yep, exactly. Those are great. Tea and caffeine. Yep, those are really good examples, you guys. Carbonated drinks. Yes, yes. Okay, here's the hard conversation. Almost anything that's not water potentially could be making your bladder worse right now. Now, that's not to say that it's not your fault that you drank these things and now you have these bladder issues. It's not that. It really works the other way. Now that you're in this situation where your bladder is overactive, drinking things that aren't water can make your bladder even worse. Okay, so it's not that these drinks caused it. It's just right now, while you're not having great bladder control, these drinks can potentially make things worse. And so the flip side of that is if we identify which ones, then we can take them away temporarily as we get our bladder more stable and working better. It's a tool for us to use so that once we get better, we can then put those drinks back into our diet. Anything that's not water, we're going to test. So your first strategy is for 3 days, if you can do it, you're going to try just water. Aside from the fact if you're used to having caffeine every morning, or even during the day, but it's really common for people to have coffee or tea or another caffeinated beverage in the morning. If I tell you to go cold turkey, you're going to get a migraine or a headache probably. So don't do that. Drink as little of the caffeinated drink that you can get away from in the morning or get away with in the morning, and then try and drink plain water, no lemon or lime, the rest of the day. Do that for 3 days. Okay, if you can do that. Then on the 4th day, you're going to choose one of the things that you enjoy drinking that you took out, and you're going to put it back in. So maybe it is the lemon or lime in your water. If that's the case, put it back in and see what happens the day you put it back in and the night. Okay, let's say, for instance, you put lemon or lime back in your water on the 4th day and you don't feel any difference during the day. But you notice at night you got up more than you did the previous 3 days. Then you know, for now, we're going to take that out of our diet for now until we get better. If you have your lemon and lime water and there's no difference, then no problem. You can drink it whenever you want. And in my experience, there's usually 1 or 2 key things for people that really get their bladder going. Teas are a really big one. Coffee's big too, but I think most people kind of generally know that anyway. So coffee's big. Tea of any kind. I have so many women that go, well, it's just herbal tea or it's just chamomile tea. I've had too many patients over the years that respond even to that poorly. It does make their bladder symptoms worse. So my across the board recommendation is just test it. Then you'll know. So it's a boring 3 days with mostly water. On your 4th day, you're going to add something back in and you're going to try and learn from that. Does it make your symptoms worse or does it not? And then you can decide. And you do that with each drink. So if you drink 3 different things, let's say you have a Diet Coke for lunch, okay, take that out for 3 days and then put it back in on the 4th day and check that out and see if it worsens any of your symptoms. But the nice thing is it can give you some quick wins when you get this right.